today's topic that is chickenpox. Under that we'll learn definitions, causes, risk factor, sign and symptoms, diagnostic evaluations, medical management, nursing management, and complications. So first of all, let's see the definitions of chickenpox. So chickenpox, the other name is known as varicella also. The chickenpox is highly contagious viral infectious disease caused by varicella zoster virus. Okay, so this chickenpox is highly contagious in viral virus infection caused by which viruses? It's caused by a varicella zoster virus. It primarily affects children but can occur in individuals of any age group. Okay. Primarily, this varicella zoster virus it's affect to a children. So next we'll see that is causes. So what are the causes of this chickenpox? So infections means here caused by which bacteria, which viruses here? Varicella zoster virus. Transmissions. Okay, so transmissions it may spread through respiratory droplets or direct contact with fluid from the blister of uninfected persons. Okay, so if mode of transmissions here, if the person is infected, uh, so it may transmit to another persons also. Okay, uninfected persons also. So these are the causes. So main causative agents of this chickenpox, that is a virus, varicella zoster virus. Next we'll see that is risk factor. So what are the risk factor of chickenpox? The risk factor of chickenpox, that is lack of vaccinations. If they are not taking the vaccinations, then chances to get a chickenpox. Next, previous exposure to someone with chickenpox, being a crowded environments. Okay, so being a crowded environments, examples school, daycare. Okay, from there also it may spread the chickenpox. And next we'll see that is a next risk factor, that is a weakened immune system. Those immune system is weak. Okay, uh, so they also chances to get a chickenpox, example like due to illness or medications. Next we'll see that is sign and symptoms. So sign and symptoms in initial stage, fever will be there, fatigues, loss of appetite, okay, headache. Next, rush, start a small red spot that develop into itchy, okay, fluid filled blister will be there, which then crossed over. Next, sign and symptoms, the rust typically appear in the webs and can cover the body. Okay, so these are the sign and symptoms of chickenpox. Next we'll see the diagnostic evaluations. What are the diagnostic tests we have to perform? First of all, in diagnostic clinical diagnosis we have to do, that is a based on history and physical examination, history collections and physical examination. Next, laboratory tests. So in laboratory tests such as like PCR testing or direct fluorescent antibody test may be used in atypical case or for immunocompromised patients. Okay, so these are the tests we have to perform. Next we'll move on to the medical management. Next we'll see that is a medical management. So in medical management, will provide antibacterial medications. So antiviral medications because that is chickenpox is caused by a viruses, varicella zoster virus. So against the virus will provide the medication, that is antiviral medications, such as like acyclovir. Here you can see the acyclovir may be prescribed especially for high risk patients. Next we'll see symptomatic reliefs. So symptomatic reliefs, antihistamine medications will provide for itching, antihistamines, okay, and acetaminophen for fever. So the signs and symptoms we have sense of fever also will be there, so we will provide acetaminophen for fever, and avoid aspirin due to risks of Reye syndromes, risks of Reye syndromes. Next, management, medical management, we will see that is a vaccination. So varicella vaccine is recommended for preventions, okay. So these are the medical managements of chickenpox. Next we'll move, that is a nursing management. So in nursing management we have to monitorings, okay, assess for complication and severity of patients education is required. Infections control, skin care. So in skin care, maintaining clean and dry skins, applying calamine solution for itchy. Okay, so these are your nursing managements. Next we'll see the complications. Next is complications. Complications. Okay, next complications. So in complications, secondary bacterial infections like skin infections, pneumonia will be there, encephalitis, Reye syndrome, especially in children treated with aspirins. Next complications, hospitalizations may be required in severe cases, particularly in adult or immunocompromised individuals. Okay, so these are complications of a chickenpox. Okay, so today we have learned, or we have discussed about a chickenpox.